One. Dr. Sherwin here from Artistic Dental Studio with another episode of Dental Tips of the Week for you. And today I'm going to cover the topic of gum recession. That's a relatively common problem. We see it on a daily basis. And I want to delve into it, give you some tips, very useful ones, to avoid it first of all. And also, after that, I'm going to let you know about what causes it and also about treatment options as well. So let's begin with this. Basically, what is gum recession? First of all, okay. Arzu, just go over. I think I've got a problem here. Okay, so there's a little bit of a technical problem here, so I need to show you here on this, okay, okay, good. Okay, good. Now we're on the right track. So, what is the gum disease basically? Or sorry, gum recession. As you all know, normally teeth have to be covered by gum, at least the lower portion of the teeth, the neck of the teeth, I would say. And when the gum, for any given reason, comes down and there is a bare tooth surface now, which is devoid of gum. This process is called gum recession. So, as you can see here, this is the enamel, which is the harder shell of the tooth. And this is the gum covering a part of the enamel as well. As it goes further down, as you can see here, the enamel is not covered by gum anymore, and also a part of the root as well. And this is the tricky area because this part is not covered with enamel and it is quite sensitive. So gum recession could cause some aesthetic problems because teeth appear much longer. Also, patients normally say those areas are quite sensitive, and also those areas, because they're not covered with enamel, could easily get decayed over time. So these are the problems of gum recession. Now, what causes gum recession and how we can avoid it? The first thing is the physical trauma. Whatever physical trauma on the margin of the gum could cause the gum to go further down. The second common thing is the gum disease. Normally with the gum disease, we've had a video before about gum disease. In some cases, gum swells and enlarges in volume. In some cases, gum recedes after gum disease. So gum disease could be a contributing factor in gum recession. And the third one is the biotype and characteristics of gum. Some types of gums actually are more prone to gum recession. So we're going to delve into these three, and I'm going to give you more detail regarding this. So physical trauma. There are many factors that could cause gum to recede. The first one and the most common is the brushing. You need to make sure you do the brushing efficiently, but at the same time without any trauma to the gum. How? We need to make sure if we're using manual toothbrush, the toothbrush is quite soft. We're not going to use medium or hard toothbrushes anymore. The second thing is the movement during brushing. We've had a video about this as well. You can check our videos. And normally our movements during brushing should be either like circular, vibration, or up and down, with no scrubbing sideways. The third thing, which is very common these days, is electric toothbrushes. The problem with the electric toothbrush is that they're really good, they're very efficient, but because our brains are programmed to use manual toothbrush for quite a long time, now we've shifted to something like electric. We're going to do the same movements with our hands while doing the brushing with the electric one, which is quite traumatic. So what you need to do is just to pop the brush on the teeth and let it do the job, whether it's oscillation, vibration, or rotation, or whatever it is. Let it do the job itself and then move to the next area. You don't have to incorporate any further movements. The second one, toothpicks. We've seen many people have this habit of using toothpicks between their teeth, and it could cause, especially between the teeth, over time it could cause gum recession. The third one are habits. Some people like to chew their fingernails or hold a pen between their teeth or begin to play with their gums with something like a pen or pencil or whatever. Could cause gum recession. The fourth one are the piercings, especially the piercings on the tongue, that could cause gum recession at the back of lower front teeth. And the next one is orthodontic treatment, as you can see here in this picture. When the orthodontic treatment or braces or Invisalign or whatever, when the forces are quite not under full control and they happen over a very short period of time and the forces are quite great in magnitude, it causes the tooth to move very rapidly, and normally the bone should follow, but because the forces are too high, the bone doesn't follow in these circumstances, and bone actually recedes, and after the bone normally gum recedes as well. And then another very common thing are bulbous fillings, veneers, or crowns. We need to make sure the fillings, crowns, and veneers are made with the proper contour, so there's no extra pressure on the gum margin. And frenum pool, frenum is a piece of mucosa or skin attached to the teeth, and it's something quite normal. In some cases, the attachment of the frenum gets very, very close to the margin of the gum and creates some pull to pull the margin of the gum further down. And in these cases, we need to control this because it could happen and it could be something very progressive. And the last one are teeth contacts. In some cases, especially when the patient grinds or clenches, or the teeth are under heavy forces, teeth move by the force, and over time, the gum on the opposite side of the movement begins to recede and shrink. So that's the problem with the teeth contacts, that should be always quite even and in a normal range. Now, going to the next cause is the gum disease. As I told you about, gum disease causes inflammation and we lose some gum. But in some cases, gum actually becomes more puffy, and in some cases, gum recedes, and it could be a cause of the gum recession as well. And the last one is the type of the gum. For some people, the gums are quite thin, or there could be something like lack of attached gum, because the gum around the teeth normally should be attached very firmly to the neck of the teeth. And in some people, the width of this attached gum is really, really deficient. It should be around 3-4 millimeters at least, but in some cases it gets close to even 0, and in these cases with thin gums, they're very, very predisposed to gum recession. So these were the 3 main categories causing gum recession. Now, let me talk to you about different treatment modalities. Because, if it is something progressive, once the gum is gone, it will never get back. So, in many cases, there are some surgical procedures we can definitely utilize to recreate that lost gum, that lost part of the gum. In some cases, when it is not that severe and patient is suffering from sensitivity, we can control the sensitivity by using different toothpastes or covering those bare areas of the teeth with filling materials to protect the tooth. And in cases of like frenum or something like that, we normally remove the frenums, or in cases like orthodontic treatments, we just need to reduce the forces to make sure the gum recession will not progress and doesn't get worse. Thank you very much. I hope this very short video has been quite helpful, addressing some of your questions about gum recession. And please tune in. Next week we're gonna have a very, very exciting video about how you can take care of your baby's teeth. That's a question many moms and dads ask and they don't know how to deal with it. I'm gonna address this thing. And also, I need you to share this video. And also, if you come up with any questions or concerns, you can easily PM me. I'm here always to answer your questions, and yeah, we can have a nice chat, and hopefully I can help you out. Thank you very much, and enjoy the rest of your day. Bye.